Hello, happy Easter, everybody. It's me, Esme here, and I'm talking to the wonderful Roz Pooley. If you've not watched her and her live before, she's an amazing pet behaviourist. I'll let her do a little bit of introduction, but we're very lucky today to have her here to do a Q&A session with her.
Great. So thanks very much, guys, for joining me tonight, and hopefully the information that I'm going to have for you is going to be interesting. I am doing it from the comfort of my bed, so I'm very happy. I'm certainly pleased that some work can be done from my bedroom, so I'll try not to get too comfortable and try not to fall asleep on you guys. But yes, so a little bit about me. I've been practicing as a behaviourist for approximately 8 years, and as a more sort of clinical behaviourist for the past 3 to 4 years. I'm currently on the brink of finishing my research project, which is on trainer and behaviourist perceptions of behaviour problems in canine littermates, and so I've been working hard on that, and yes, so I'm looking forward to answering your questions, and hopefully what I have to say is of interest to you. So thanks for joining.
Yeah, we've got some really good questions already, so I'll get it started.
Great.
Stephanie Whiffen, she commented and asked us a couple of questions actually about her dog Jack. She says, her dog Jack gets very stressed when out in the car, and he surfs a lot when it's in motion, and she struggles to get him to lie or sit down. When he's going home from a walk or hydro or from family visits, he seems fine and he's really calm, soft face, soft ears, much more relaxed. And for a long time, she thought the behaviour was sort of overexcitement. And now she thinks actually it's probably stress. So he has a tight face, lots of whining and barking, erratic movement, shaking off afterwards. He does get into the car with no visible issues and is calm, but then as soon as it starts to move, his anxiety builds, and as soon as they get close to the destination or they get into a traffic light, it really becomes quite obvious. He has got arthritis, so she thinks it probably is adding to the stress, and there's probably a bit of a pain cycle going on there. And she's done a few things with bedding to encourage him to lie or sit down, but it doesn't seem to make any issue or any difference, sorry. Actually, the bedding in the boot made it more slippery, which seemed to worsen things.
Okay.
So she's just wondering if it's the emotion of the car that's the trigger and how she can help him.
Yeah. So thanks for the question and the information. It's really useful. I think, obviously I have to say with each question I get, the advice or input I have to offer is going to be based on very limited amount of information.
Yeah.
And normally what I would do is take a very extensive case history, as well as potentially request some video footage, or in some instances see the behaviour myself. And I would also be looking at visually assessing dogs, looking at how they move, looking at how they move around the context in which the behaviour problem happens, and obviously working via vet referral. So it is important for me to acknowledge that that's just, a very small portion of information compared to what I would normally get.
Absolutely.
I think one thing that is worth acknowledging is that arousal can be positive and negative in sort of its underpinning emotional state, and sometimes what we can get is a sort of crossover of emotions, and where arousal gets so high that even though the initial emotion motivating that highly aroused state might be what we would consider to be positive, for example excitement, the effect or the physiological effect that it can have on the body is generally relatively similar, even if that emotional state was more negative, such as anxiety or fear. Now, obviously, if we know we've got some arthritis going on, then it's possible that we do start to get a little bit of anxiety, but potentially side by side with some excitement. And often we refer to these sort of duo of emotional states, or a mixture of emotional states, as conflicted motivations or conflicted emotions, where it's just not clear cut as one emotion. We can sometimes feel really excited about something, but equally a little bit nervous about it. And that may be what's going on here, is that the car predicts going to an exciting place. However, it also predicts this, oh, well, you know, I'm struggling to settle down, and also it's difficult to stand up. And so now I'm also starting to get a little bit of sort of anticipatory anxiety, or even in the car, you know, a much more anxious feeling on the physical challenges of being in the car in that aroused state. So it may be that as a youngster or a younger dog who didn't have arthritis, that he was able to manage his excitement a little bit better, or at least be able to stabilize in the car when it's moving. And that's something that I would be looking at if I was, you know, to get this as a case. I'd be looking at, well, how did they used to behave? You know, looking at the onset of the behaviour and the journey that that behaviour has taken over a period of time. But let's just say, you know, that it is a mixture of both. I think what says to me that there's an element of excitement is that potentially the fact that they calm down after a walk or after going somewhere they like. So that to me is evidence for. I would need to get more information to, including visual observation, to sort of really, you know, sway towards that diagnosis of that emotional state. But I would certainly say that's a potential reason for, you know, sort of saying this is fueled by some level of excitement. That said, it could be that after a walk or after hydro, they're tired. And so actually that becomes the overriding physiological emotional state is I'm too tired to stand up, so I'm going to lie down. I think what I would look at doing is, because we know we have got, you know, sort of arthritis, you know, we've got some, you know, we've got to manage their comfort in that context. I would be looking at dealing with this as much more of a sort of making sure the environment supports the behaviour that we want to see, which is one of more relaxation and, you know, and comfort, and just having a dog more settled in the car. So I generally find, and this isn't always possible because everybody's got a different setup, whether they have family members that need to use the back seats, or whether the dog is simply too large to go on the back seat. But generally I find that the boot of the car is much more unstable than the middle of the car. And when I had my large dog, Denzel, he was a 30-kilo sort of lurcher Labrador cross. What I had on the back seats were, it's like a bridge that covers the footwell on the on across the back seat, so they can't fall in the footwell. I got it from Zooplus. It's called a car bridge. And then I had sort of flat mats, like padded mats on top of that. And then I had dog bars dividing the back seat from the front seat, so that if I was to break, he's obviously not going to end up in the front seat. So safety is really important. So that's something I would look at, seeing if it's a possibility to introduce that to try and encourage them to settle down. I mean, the fact that he is able to settle down on the way back from a walk suggests that he can in the boot, but the sliding beds is potentially a reason, you know, if he is feeling a bit more excitable, and then those beds are going to move around more than if he's tired. So it may be looking at securing the beds so they don't slide around. And also sometimes, depending on his level of anxiety or arousal, en route to a walk, you could look at giving him a Kong or something like that in the boot, or on the back seat, to see if that motivates him to do the incompatible behaviour of, you know, so that he actually lies down to have that Kong. So that's something that you could try. If he's so aroused that he can't take food in that context, so he's just, you know, a mixture of emotions, maybe excitement and anxiety, or just excitement, we don't really know with the information we have. But what I would suggest is that you introduce the Kong with the car stationary. I mean, what's great is he jumps in, so he's not scared of the car.
Going in the car, so
Yeah, and I think that's evidence for it being, there's certainly some positive emotional state going on there, is that, you know, he's willingly going in the car. But certainly, you know, if I was him and I was a little bit sore, then I'm not, you know, I'm sure that sort of trying to stabilise during a car journey is going to, be increasingly difficult with arthritis. And the other thing that was mentioned was that traffic lights, he gets a little bit worse. So when the car's stationary, he actually still struggles to to settle down. That
Well,
to me,
anticipation.
yeah, it to me
Yeah.
is a potential. It's another argument for there being a strong level that the excitement and anticipation of the walk is potentially one of the main emotional motivators for the problem behaviour. Because when the car's stopping, he's like, well, come on, come on. And so you get a level of potentially frustration and anticipation building. So with that in mind, I would be like, well, let's try and increase his motivation for doing the other behaviour, which is perhaps to lie down with a Kong. But you may want to introduce that when the car is stationary. And I would probably, again, looking at increasing motivation, I would first get the walk out of the way. So he's had his walk, perhaps give him half an hour or 45 minutes, maybe even longer, depending on how much rest as an individual he tends to need following a walk. But I would soon after, so not at the time that he would normally go for, let's say, a second walk, I would get him back to the car and having a Kong with the car stationary. And then I would repeat that, but gradually it would be that you perhaps turn the car on while he's having a Kong, and then you might move the car a little bit. And, with dogs that are highly anticipatory with car journeys resulting in going somewhere really interesting, one of the pieces of advice that I do give is actually taking them to places that don't result in what they're expecting.
Yeah.
I think we need to question the ethics of that if there is pain involved, because we don't want to increase the frequency of being exposed to things that make him contract his muscles too much or cause his joints to become stiff. And so that's where I think looking at the car environment as well is really important.
Yeah.
But yeah, so there's certainly lots of different things to try there.
Yeah.
And like I appreciate that not everybody's situation's the same. Like some people need their back seats for free for children. I'd put them in the boot. I'd put the children in the boot. I'm joking. I'm child friendly. So yeah.
From
So
like from a pain practitioner perspective, I think everything you've talked about is really, really interesting and valid, particularly about the excitement. My personal tips, I really like the hammocks as well. I think the dog bridges are really good, and I like the dog hammocks that go between the front seats and back seats. I find a lot of dogs will rest their head on the side when they, especially if they've got pain, because they're trying to stabilize themselves, to try and give them that space where they're not going to do as much rocking and they're going to move with the car. Does seem to help those dogs. It's just getting them in and out of the car that can be more tricky.
Yeah, I found with the hammocks, because I ran a dog walking business up until July last year. So I started off with hammocks, and I find that hammocks suit dogs that are generally sort of less than maybe 15 kilos. But as soon as it's a slightly larger dog, I find that they really struggle to get the stance they need to stabilise, because the hammock curves up at the side. Whereas the car bridge that I still have from Zooplus, it's literally a plywood bottom with sort of a cover. So it literally is just a flat, and it almost turns the back seat of your car into the size of an estate. So it's really good for large dogs, but a hammock is perfect and actually potentially more cozy for small dogs. And one thing that I do recommend for very small dogs is the booster seats by Ergo I think it's oh god, my brain's gone. I've got a thesis brain. This does happen, I'm afraid. Thesis brain is a real thing. I might write another, maybe that can be my next research project. Yes, every now and then my brain just goes, no, it's all taken up with other things. But yeah, I think it's Kurgo. They do little booster seats, and they're really padded, so I think they absorb the vibrations really, really well. For some dogs, they're really cozy, and we've just observed that some dogs feel really secure in them. So it can be a bit of trial and error, but really we're looking at addressing all of the things that might be motivating the behaviour, which is potentially vibration, also anticipation, and looking at trying to address those things, and then gradually build up the protocol systematically. So starting with, if dogs are so aroused they won't take food, then we really need to introduce that food at a time when they're going to find it most reinforcing, which will be when they feel satisfied they've had a walk, and they are in the right place to enjoy a Kong. So it's all about getting the timing right of when you introduce that protocol as well.
Brilliant. I
Good
think that's
question.
brilliant.
Yeah.
Yeah, absolutely. We've got lots of questions coming up here as well. So somebody has asked what percentage of canines get arthritis. I think the stats are 80% of dogs over the age of 8. So it's a large percentage of dogs, and they don't have to be over the age of 8. I've seen dogs at 6 months starting with arthritis. So it's one of the real problems we see.
Worrying amount of young dogs seem to be suffering from skeletal issues, including arthritis. It's certainly a worry. Yeah.
Absolutely. We've got Anne here. She says, "Hi, my dog keeps jumping up with excitement when I'm feeding her. I do tell her to sit, but sometimes she just cannot control herself. Food is everything to her. I know the feeling. How can I stop her, please?"
I think we all know how important food is at the moment. I don't know about you guys. My food bill at the moment is right up there. So yeah, food is definitely my life right now. So when it comes to those sort of problem behaviours, I'm always assessing motivation. So by that, what's the reason behind the behavior? What do they want? What's the function of the behavior? Are they jumping for attention? Are they jumping to get food? And are they jumping because they're overexcited, and possibly they're overexcited because of what they want, and they they might be frustrated also that they can't get it. So there's lots of sort of reasons. What's the emotional motivation behind behavior, but also what's the function? Why are they investing energy in this behavior? And then we're looking at, well, what do they get out of the behavior? What's the consequence that they get? Because consequences drive behavior, and those consequences can sometimes be beyond our control. Sometimes it doesn't matter what we could do nothing, and what the dog feels, or it could be a dog, a horse, any species, what they feel can actually drive the behavior. So sometimes I always like to let people know that it's not always a case of, oh, it's your fault and what you're doing, because actually intrinsic reinforcement is very much a thing. So, but we're looking at what do they get. So let's just say that you're holding treats and your dog is jumping because they want the treat. So, we've there got a behavior and a consequence. So then what I'm going to look at is under what conditions, because I'm going to assume that individual doesn't do that behavior 24/7. So there's going to be specific conditions on which the behavior occurs. So let's just say that you pick up a handful of treats, and that's the cue for the behavior, and the consequence is that they get closer to the treats, or that you perhaps move your hand and you build anticipation of the food's moving, so I might get it. Or it might be our response. And so, I always let my clients know that when we give a cue, so if we say to our dog, sit, if that behavior has been taught using positive reinforcement, that cue is probably a reinforcer because it accesses reinforcement. If you've said sit and then reinforced with the treat in that dog's lifetime 500 times, that cue is a reinforcer. And what they can do is chain. So I jump, she says sit, I get a treat. So really what we need to look at is, one of my little mottos is beat the behavior. And it's a case of, if we have identified the conditions under which a behavior happens, then we need to try and beat the behavior. So as an example, let's say we'll go to the example I used, that you pick up treats and you very quickly give a treat before the jumping happens. So that's what I would be doing, is I'd be getting treats. I wouldn't be asking for a sit, because it may be that the latency between giving, so the time between giving the cue and the behavior of sit potentially being, the information being processed, the body going into position, it's just too long, and we're potentially setting them up to do behavior. So what I would initially do is beat the behavior. So take food, treat, take food, treat. And what I like to do with my training is build up anticipation. So through a high frequency of repetition, I build up anticipation. And more often than not, what anticipation looks like is waiting. So you get a pause. So as an example, pick up treats, quickly treat, 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 and then I start to pause, and then treat. And what I'm then doing now is reinforcing non-jumping behavior. And when you can see that you have more calm, focused, non-jumping behaviour, then I'd put my cue of sit on. Now, over time, what you'll have if you're consistently, every time under those conditions, beating the behaviour, then what you'll probably start to get is anticipation in response to those conditions. When she picks up treats, I wait on the floor and I'm more likely to get a treat. Now, if you did get jumping, I would absolutely just pause food. So I keep it really close and I don't acknowledge behaviour. But as soon as I get pause on the floor, I would reinforce. And again, I'm looking at a high rate of reinforcement to build up anticipation. And then I start to slow it down. I think it's worth looking at how excited dogs get. So, you know, if they're really, really excited, then sometimes if the food is too high value, that can make it very difficult for some dogs to focus. And they can get a bit frenzied. So potentially using lower value treats or also adding higher value food to their diet. Because if the only time they get meat is when they are training, then some dogs do go like, it's the sausage, I can't focus. Whereas actually if they got a bit of wet food with their kibble, then it's not so novel. So I do look at what we call sort of my thesis brain is kicking in again. It's totally escaped me, but it's looking at motivation and looking at not just the initial motivation, but the distant motivation. So, you know, what's really going on underneath the surface. If a dog's really, really hungry, they might be even more motivated to jump for sausage than if they just had some food that had some wet meat in it. So I'd be looking at those things. Again, it's, you know, with that information, there's so many different contexts that spring to mind, but hopefully my answer helps them understand how I would problem solve with that behaviour.
Yeah, absolutely. I think the one caveat I'd put, obviously being a CAM ambassador, is when you're doing this training, just take that out of your doggy's food allowance for the day. Please don't end up with a real doggy. And I think this is a good thing to try and solve, because a lot of dogs who are jumping it for food, you know, the jumping is not great for their joints, particularly if they're getting older and arthritic. So that's something we want to try and target.
And this is it. I think with positive reinforcement, it's, you know, it goes without saying that whenever you're training, if you are, I mean, I don't leave the house without treats. So my dogs are positively reinforced throughout the day. And I think their meals are actually quite small. But same with me, I don't eat 2 massive meals a day. I graze throughout the day. And so I think it is absolutely crucial that if we are using treats, you know, and there is no shame in using food, because they need food to survive. So we might as well use it as a tool for behaviour change. But equally, it's, you know, there's a couple of pitfalls to positive reinforcement, which is weight gain. I feel like that's easily resolved personally. You know, I understand it's pet obesity. Pet obesity is a real issue. I see so many overweight pets. And then also the other issue we see is frustration. So if people withhold food too much, or they move food around, or they go to give food and then change their mind, then we can get frustration as a byproduct. And behaviours associated with frustration sometimes can be, you know, quite scary or dangerous. Some individuals get very angry when they're frustrated. So to me, those are the 2 main pitfalls of using positive reinforcement. So so we always need to be careful.
But the good thing is that if you are feeding your dog regularly, lots and lots of little meals, each time you feed them, they're releasing all those lovely endorphins, and they're a natural pain relief. So you are actually, in some ways, helping your pet, one, feel happier and maybe a little bit more comfortable. So there's definitely positives to it, alongside all the behavioural positives as well.
Definitely the feel good factor. And also I think, you know, it is important, I would say, is if you are using positive reinforcement, generally I would use something really low fat. So I wouldn't be using pedigree churn, or, you know, I'm not sure if I'm allowed to say that, but actually a lot of these treats have a high sugar level, and if you use them at the rate that I would use them, then your pet might, you know, put on weight, but also they might actually start to act overexcitable because of all of the sugar they're consuming. So actually sometimes just either using, if you feed a dry food, that but also I use, you know, chicken, and you can use loads of low fat treats as well. So I think don't feed lots of packaged treats like Wag or Pedigree Chum, in my opinion, because they are full of sugar and potentially more prone to weight gain. So.
And they really are the definition of a treat, aren't they? That's like us trying to train with cake. You know, you've got to be careful and have everything in a
Nothing
balance.
wrong with training with cake. Yeah,
Depends
personally,
how much cake you have. That's it.
I'm happy to be trained with cake anytime. Yeah, it's really not a problem. You can fire cake at me as much as you like.
Oh, so we've got lots of people saying hi. Hi, Debbie. So I've got a few more questions that we were asked on the post. Amanda asked about anxiety in older arthritic dogs. So her dog Tess is 12. She's a retired gun dog with arthritis caused by injury, sadly, by being hit by a car. She's on Galliprant and paracetamol, and she knows that pain can exacerbate anxiety, but she's also got raised liver value, so she doesn't want to add in any more medication at this point when she can't do bloods first. In the last couple of years, she's become more anxious, but the anxiety has been about being in the garden at specific times. So she's happy to go out first thing, just sniff around, have a good wee and be happy. She goes out at night on her own quite happily, and she's fine if they're doing scent work or scatter feeding. But if her owner, Amanda, wants to sit outside just doing some gardening or just chilling, she gets really anxious and she has to sort of really stick by her side. Sometimes she'll stay indoors, but she's quite conflicted because she's anxious and doesn't want to be away from Amanda. And it all seemed to start when her neighbour got out his really loud lawnmower and set her off. She will even get scared in the house when they're all together, but the doors are open. So, but she's still happy going on walks. She likes walking new places and she likes other people's gardens. So, what would you recommend in this circumstance?
Yeah, it's a bit of a tricky one, that. Certainly something where, if that was a behaviour case, I would probably have to get a lot of information to really understand what might be going on. It goes without saying that obviously, she's a great age. My dog Denzel lived up to 14, and even without symptoms of CCD, sometimes you can get that sort of slight increase in vulnerability and slight increase in confusion. But it sounds very much like very context specific learning that
Yes.
Potentially sometimes we can call it suspicious learning, where something totally unrelated has been paired up with an aversive event. So it may be that with the neighbour's lawnmower, that her owner was doing a certain something at that point in time, and that somehow has been bundled in with that association, that when I see this information, when this information is presented to me, I associate it with that. So that might be what's going on.
From a chronic pain perspective, just to jump in, I often see new anxieties created when, for example, the loud clang went off, the dog jumps forward, sudden pain, and now outside's really scary, particularly at certain times, because they just don't know when the bang's going to happen and when they're going to hurt again.
Yeah, and we have research that shows, noise sensitivity is linked to pain. And it is, they think because of that sort of the startle response or the jump, and the pain that they experience at that time. I think the fact that we've got some behaviours where she is able to actually go out on her own, which is really, really good. And that she's able to do search games, which is a lovely game to play with your dog. So well done for doing that. But it shows that it's not totally generalised to the garden in itself. So then what I would probably suggest, or I would need more information, but initially what's coming to my mind is, well, if she likes search games, then what I'd probably do is introduce them. I'd perhaps let her get a little bit stuck into them. And then I would very briefly dip into the activity that causes anxiety. So as an example, I might set up a chair and I would sort of set the scene for search games using the same training cues of perhaps normally she stands up or she's like, search, go search over here, go on then. And there will be body language cues that her owner does that says this is a safe situation. So I would give those cues, and then when I see that she's really settled in and she's like, I know this game, this is great, then I'd perhaps move towards the chair and then move back away. So I would almost just dip towards the aversive and pull away from the aversive before it becomes a too bigger, you know, trigger for a negative emotional response. And then I would just gradually sort of like a little sort of swing or pendulum. But, you know, you're looking at, you have to be so careful with the frequency that you move towards aversive, the duration that you're there, and the intensity of the aversive. So all of those things are, you know, you just have to look at how much of a big deal was that for that individual. A really great way of deciding whether to stick with it or push it a bit or go back a step is a concept called push, stick and drop. And it was developed by Jean Donaldson. It's really useful. So basically, I always say if a behavior is really fluid, it's really easy, there is no hesitation. So let's say she's searching and you move towards the chair and she's like, I don't care, I love this game. Then I would be like, okay, I can push. It was fluid. There was no hesitancy. The behavior that I wanted was in full momentum. So that's cool. I'll push. The next time I'll go a little bit more towards the chair, or I'll pick up my gardening trowel. I'll do a little bit more. If you see a little bit of acknowledgement or a little bit of hesitancy, so she's searching, you move towards the chair and she goes, then I'd probably stick. And then if you move towards the chair and you get what are you doing? What are you doing? I don't like this. That's a drop. So we're looking at the momentum of behaviour and how it changes as we sort of start to increase the stimulus of the aversive. So that's what I would recommend with that particular dog, partly because they're already on medication, and also that the behaviour is very specific. Which is a good thing. You know, actually this dog's able to go out into the garden on her own. She can hang out in other people's gardens. So it's great that this dog isn't so impacted by the behaviour problem that it's affecting everyday life at a drastic level. So that's really good.
Yeah, really, really good. Okay, cool. So, some more questions we've got. Karen Gill, this is more of a pain management question, so I'll quickly answer this. Her girl Sally is 19 kilos, 5 on the body condition scoring. Well done for doing that. I think that's really important. But she's been forward during her 40 days. She's been on Galliprant for a while. Initially, it seemed to help with the therapies such as massage and hydrotherapy. She's become stiffer in the last couple of weeks with her front limb being more pronounced. Karen's wondering whether she could add in another painkiller. She's not overweight. She's 11 to 12 years old, and her blood came normal. So obviously, again, this is very difficult to answer because I don't know Sally personally, but what I would say, we've got I've written a CAM conversation on different types of pain management. I think it's important to work with your vet and try and work out what type of pain you think that Sally might be experiencing. So there could be neuropathic pain, in which case maybe a drug like gabapentin, amantadine, memantine, that might be a good option. There's probably muscular pain, which comes in the nociceptive category. So something like paracetamol might be a good option. It depends how much you think she's suffering, because the drug like tramadol, that works on the emotion center in your brain called the limbic system, and that can be really useful as well. So it just depends a little bit about what's going on. But my big advice with this would be just to give your vet a ring and have a good chat. Most vet practices are really happy to have a conversation over the phone, or do like a telemedicine conversation over basically like what me and Roz are doing now, just to have a chat and out what might be best for Sally. But there are hundreds of different options for you, and it's great that you're looking at multimodal practice as well, so using your massage once corona's all finished. There's another similar sort of question from Debbie Glanville, where she's just saying that her older dog has hip dysplasia and is on Metacam. It doesn't seem to be helping her a lot, and she has arthritis on her front legs and they're starting to become very weak. What would I recommend? My recommendation again would be the same sort of thing. Have a chat with your vet about what type of pain you think that your dog is experiencing. And maybe once things have resolved a bit, I would probably suggest physiotherapy would be a good option for her if you're seeing in a bit of muscle deterioration or lack of strength. There's loads of great physios out there who can help you with building up muscle there. So back to some behavioural questions. So
I'll just apologise for moving my camera while you were doing that. I had to charge my phone. and it's now really precariously balanced on a cushion. So I'm going to apologise in advance. The issue is, if I'm not very good at not gesturing, so at some point I'm probably going to do a wild gesture that will knock it over. So I apologise in advance. Yes. Okay. Right. Ready when you are. Sorry about that.
So I've actually got a question about my own dogs. So I've got two really naughty little dogs. I've got a Jack Russell cross, maybe Chihuahua something mongrel, and a sausage dog, and they are really, really friendly. I've done a lot of socializing. They come to the vets, they've met lots of dogs, and they are really good off lead, brilliant with other dogs. The Jack Russell, this is not going to be a surprise, he's a little bit gobby. We say he has a little man syndrome, and when he's on the lead and he meets another dog, particularly if they're coming face on towards him, he starts to get agitated. I know he's going to get agitated, so I pull him backwards, and the more I stop him going to say hi to another dog, the worse he is with gobbiness and sort of leering towards them. If I let him go, he'll just go and he'll be really friendly and he'll wag his tail and he's lovely and he interacts really nicely. But I'm finding in this coronavirus issues where we're not really allowed to take dogs off the lead, and we're not walking them in a normal circumstance, that it is quite tricky to manage. So I thought that'd be quite an interesting thing to discuss with you.
Sure. I first certainly touched down on little dog syndrome. So I do work a lot with Dachshunds. I see they're very popular in Bristol. I think they're probably popular across the UK. And I think, when it comes to small dogs, or just looking at dogs in general, that it's really important we recognise that out of all the species, that dogs actually have this really broad phenotype, where you have these really small dogs, and then you have these really big dogs. Like, you can have a Chihuahua and a Great Dane, and they're the same species, and it's quite an amazing thing. But at the same time, we have to acknowledge that actually for those small dogs, can we imagine meeting someone that much bigger than us? How might we feel? And I think I know how I'm quite petite. I'm only 5'2", and when I meet someone who's over 6 foot, I'm like, oh, you're really tall. But actually, imagine that times about 10. It must be just quite a strange thing. And then additionally to that, they don't get as much of a vantage point because they are lower to the ground. So life often, in my opinion, probably springs up on them a little unexpectedly sometimes. And so these breeds are prone to being quite vocal. And, I think that, yes, in some instances, they're bred to be, some dogs are bred to be alerting breeds, and that's why they have vocal tendencies. But when we're actually seeing it in the more small breeds, such as Chihuahuas and Dachshunds, and why we've sort of seen this increase in vocalization in the breeds over the years, I think it coincides with the urban life is quite busy, and it's getting busier and busier up until recently. And that these small breeds are actually often, becoming quite hyper vigilant. So that's just to expand on little dog syndrome, is I think that they, it's actually sort of looking at life from their perspective. And that's why you see some Dachshunds when they're walking and their neck is extended to the absolute highest it can possibly go, because they're trying to see as far around as they possibly can. So anyway, I think, with that information, that with small dogs, and it's not just small dogs, I've seen it in lots of different breeds of different shapes and sizes, but when they're off lead, they can potentially control how an interaction starts by choosing to instigate it. And sometimes what happens is with dogs, they may rush into an interaction, so they may run over. And the reason they may do that is that perhaps there's a slight underpinning of, well, if I just let my guard down and sniff this individual might come up behind me. And because I'm small, or maybe if it's a larger dog, it might be I'm just generally lacking confidence, that doesn't sit very comfortably with me. So you get some dogs who decide to rush into interactions. That wouldn't be the only reason. Dogs can rush into interactions for lots of other reasons. However, when that coping strategy for instigating an interaction under their terms, whatever those terms might be, so is whether they're doing it to, some dogs will rush at another dog, so then they get information from that dog on whether, are you friend or foe? If I rush at you barking, and I'm not suggesting your dogs bark while they're running off lead, but how the other individual responds is valuable information. So they can assess, am I safe based on how you respond to my behaviour? So it's almost kind of like a preemptive preemptive strike in some instances. If I go in quite fast and, if you back off, then I know you're a conflict avoiding dog. That's cool. We're going to get on fine. So with that in mind, when that strategy is removed, and because the individual's on lead, then you can get a mixture of emotions, and I will again go just backtrack a little bit just to make sure, because it is a very generic bit of advice giving. Sometimes it is just that the dogs want to rush over because they're so excited to say hello, and even then, if they're on lead, they are being thwarted from gaining that reinforcement. So then it's a case of, right, now I don't have my strategy. So I potentially, let's just say it is that I'm small, I like to control the interaction, and now I'm not able to do that. I feel a little bit anxious because I'm trapped and I'm unable to use my strategy. Or if they're really social and they're like, I just want to go say hi, then they're being thwarted from accessing reinforcement, which is to socialize with another dog. And as soon as we get thwarting, it's going to be frustration is the emotion. What happens with frustration is before we enter a frustration state, we build anticipation. So we're anticipating something we want to do, or a reinforcer. So we're anticipating, in your dog's instances, running over to the other dog. And then so you build this anticipation, and what starts to happen is as soon as there's thwarting, you get a dopamine drop. And with that dopamine drop is basically pretty much what frustration is. And you can get all manner of behaviors. So you can get frustrated you can get outbursts, you can get whining. It really depends on the individual. But you can get pretty angry. And I think if we look back at whenever we're angry, more often than not, anger is associated with frustration. Something didn't go our way and we're upset about it. That's usually what anger is. So it's possibly frustration or fear, or maybe a mixture of both. What I do is, with any problem behavior, I always acknowledge that dogs pretty much are guaranteed to outspeed us. They are very, very fast. Humans are very, very slow. So
Excuse me, while I'm plugging my laptop. One second. Continue talking,
you're
Roz.
the same as well. That's fine. As long as you're not like me and you're knocking it all over the place. So I always treat a behavior as if it's predictable. I try not to wait for signs that it's going to happen, because more often than not, if I wait for some evidence the behavior is going to happen, when that behavior is quite frequently rehearsed, we will probably get beaten to it, because dogs are very, very fast. So what I would be doing is working really on, there probably is an element of frustration to the behavior. So when you get frustration, you're going to look at providing an alternative reinforcer for an alternative behavior, because there's thwarting for this behavior and this reinforcement. But we want to say, well, yes, you can't get reinforced for that, but you can get reinforced for this. So I would work really heavily on a recall and move away behavior. And I would initially practice that really heavily with no dogs present. I would work on both dogs, but certainly using, you want to be recalling the dog that's most likely to react first.
So best to train each dog separately in this circumstance.
Yeah, but you'd be surprised if one dog, that would be the best, most thorough way to do it, but life isn't always so simple. If you have a dog that's very easily influenced by another, you'd be surprised at how you can get a 2-dog turnaround by recalling the one that is the influencer. So if they are a little bit of a duo, then you could just focus. I would still work on both, but focus the majority of your recall on the influencer. And you would probably end up where, if that dog's going, the other dog's less likely to react if that dog's turning to you and coming to get reinforcement. So what I would be doing is, whenever you see a dog, well and truly in advance, so way before they would normally react, I would be recalling, crossing the road, high rate of reinforcement for both dogs until that dog's passed. And then over time, you gradually decrease the distance at which you would recall them. But generally, I don't do on lead greetings with dogs. I just tell my clients, why would we? It's not an ideal situation for dogs to greet. They're on lead, they're head on, it's a narrow pavement, tight leads. Why would we do that? I think this notion that dogs, obviously if they bump into each other on a corner, we would want them to be able to manage that nicely or recall out of that situation quickly. But I don't think on-lead interactions should ever be a goal. I think we should just focus on a really strong recall, so that if we do come kind of head to head on a corner, you can recall your dog and they're going to move out of that situation really fast because you've trained it so well. I just don't think streets are the best place for greetings. So I think I would be working on that. Sorry, my colleagues just entered the room. So I would certainly work on a really strong recall, start it way beyond the point at which you would normally think is this going to happen, and cross the road, really high rate of reinforcement. And then what happens is over time you reinforce a little less, so you would slow down your rate of reinforcement, creating these little pockets of observation where your dogs would take a treat, have a little look, come back and look at you. And that's what we want. We want them to look at the other dog, and for them to go, yeah, I'm actually going to come back to you and get some food for it.
Yeah, brilliant. Oh, thank you.
I make it sound easy, but it really isn't.
Yeah, I've got a lot of it sounds like. Brilliant, thank you. So we've got another comment here. So this is Ricky. She's said that the dog's got arthritis and cruciate damage, and they try and keep her relatively calm as much as possible. At night, though, letting her in the garden, she goes absolutely bonkers, as foxes tend to be around, or at least could be. Even putting on the lead, she's putting so much pressure on the joints, desperate to rush into the back of the garden. How do they start to work towards desensitizing her to this? It feels like a day of not much exertion is ruined every evening.
Right. Okay. So if she's really food motivated, you'd be like, she's mentioning treats again. But it is just, again, dogs need food for survival. Why not use it as a tool? Generally what I tend to do is, again, treat the behaviour as predictable. Don't wait for it to happen. It is good a lead is being used. I think that's really good attempt at managing the behaviour, and it's certainly something I would be looking at implementing. I would certainly be worried about a dog lunging at full pelt into a collar. So looking at maybe a harness. But actually what I would do is probably sprinkle some treats by the back door without it being open, and then while she's taking it, sprinkle some outside the back door, so then she's like got a treat trail to connect outside, and then continue that treat trail. So basically turn it into a treat search, and then over time it would be that you would fade out some of the treats, so the treats on the inside would stop because you have anticipation of the treats outside. And more often than not, sniffing actually stimulates going to the loo anyway. So often dogs, if you notice on walks, they'll often sniff something, and then, they might have a wee. So generally I find that it's quite a calming activity, and they will probably, once they finish their treat search, have a wee. And you can fade out the treats gradually, because partly is that predatory charge and that rush of adrenaline that they get is the reinforcer. It's a lot of intrinsic reinforcement, and on the off chance there's a fox or a cat and they see them startle off, so getting their head down and sniffing is a really simple way of managing that behavior. You can train a door wait as well, so if I was there in person, I would be also demonstrating a door wait behavior. So then, just for the additional mental exercise side of things, and I think it's also satisfying for clients that we're not just throwing food around. However, treat searches are sometimes such a great strategy at managing arousal. Obviously, if the dog's arthritic, we have to bear in mind how easy is it for that dog to pick up treats off the floor. Some dogs really, as they get older, might find it really difficult, especially if they're tall, to get their nose to the ground. So we need to always review how easy a behaviour is, because if it's painful, it will become less reinforcing, and therefore there'll be less motivation. So it's not always as clear cut, but hopefully this dog will be.
Yeah, hopefully. So the first dog we talked about, the owners just said, thanks for all the advice. They're going to give that all a go. So that's really nice. Let's have a look else. Okay, so let's have a look at this one. So, hey, Roz, hope you're well.
Hi,
question
Rachel.
for you.
Sneaky viewer. So I know Rachel personally. What are you doing here?
So she says, Tilly, her 9-year-old Sprocker has arthritis diagnosed in her front paws. She's coping reasonably well on Metacam and UMove plus tablets at the moment, but has odd days where we've done more walking and she seems more uncomfortable and lumps for the next day or so. We often give her a rest day when this happens. My question is it possible that my other dogs, Brandy and Peanut, can sense that she is suffering? Brandy in particular is showing some signs of pushing Tilly away from me as if she's protecting me from this. I feel like Brandy is being my bodyguard, and this has only started happening since the arthritis was diagnosed last year. She's herding Tilly away from me, and there has been some unwanted behaviour because of this that has not happened before. Any advice, please?
Yeah, it's really interesting. I think, dogs are incredibly perceptive. And, I think what you start to see with multi-dog households is that more often than not, younger dogs will defer to a more confident older dog. And so that's quite normal. However, what often starts to happen is that as older dogs become a little bit more vulnerable, then the sort of younger dog then starts to sort of, potentially control access to resources a little bit more. So they seize their opportunity to control access to resources. So, the word we would hate to use is dominance, because of what people associate dominance with. I have a feeling you've frozen, so I'm not sure if everyone else can. I think Esme's frozen on my screen, so I'm not sure if everyone else can hear me. So I'm going to pause, unless Rachel, you're able to type something else that I can see. But I'm going to pause until Esme is no longer frozen on my screen, just so I'm not talking to myself. Good boy, Ray.
Hi, guys. I don't know if I can see Roz. Can you all hear me still? I'm really sorry if you can't hear me. We're having real problems with the BeLive app that we use to stream everything. Oh god.
Okay.
There we go.
There we go.
Sorry, everybody.
No,
Having disaster. I think with everybody's live at the same time on the BeLive app that we're using, and we're getting a bit lost. But we're back. So sorry about that, guys.
Hannah just rang me, was like, "You're still live," and I was just like, "Well, I didn't want to just talk and then no one be there, so I opted for the silence and just to make sure I didn't do or say anything inappropriate to my." So anyway,
sorry, guys.
That's fine. So just going back to Rachel's question, then yes, we do notice that in multi-dog households there can be a dynamic shift where younger dogs may start to control access to resources when they see sort of vulnerability or weakness in older dogs. That's is unfortunately normal. It depends on the older dog, and it also depends on the younger dog. So it's never a given, because as we well know, dog personalities are broad, and no two situations are the same. But yes, it's absolutely probably the case that she's observed Tilly is tired, in pain. She's not as strong as she was. They can see all of this stuff. They can probably smell chemical changes that us mere humans aren't capable of. So really, it's about managing behavior and preempting it. So when Tilly is tired, I would be looking at perhaps giving her some space away from the other dogs. Or when you're and giving her plenty of attention in that little space, safe space, so that she's not being out competed for attention. Because I do feel with older dogs that, additionally to feeling a bit sore and uncomfortable, if they're then also getting pushed out of the way, and that's another confidence debilitator. And I think to keep them confident, it requires us trying to prevent them hitting sort of trigger points for chipping away at that confidence that we need to keep as much as possible. So yeah, it's looking at preempting it, giving her lots of attention where she doesn't have to compete, or alternatively, if all of the dogs are together because that's what they want. If you see that you go to give Tilly attention and Brandy pushes Tilly out the way, I would just move in front of Brandy in a non-confrontational way and resume giving Tilly attention. But I would absolutely give Brandy attention for not barging Tilly out of the way. So you want to help Tilly understand that just because this dog's a little bit, just because Tilly's a little bit weaker, then it doesn't mean that you have to do this behavior to get my attention. The quickest way to get my attention is to just wait patiently. And sometimes give Brandy that attention first to decrease her motivation for barging. And I think this is where, looking at our behavior, we love our dogs dearly. When we see they're uncomfortable or they're sore, we're going to migrate towards them. We're going to want to reassure them. But if we go to do that more than we might do normally because pain is involved, then to the other dogs, that's potentially, they're going to be like, oh, well, it's an imbalance they might not be used to. So it may be that actually you're like, right, yes, Tilly needs lots of attention, but if I give Brandy a little stroke first, then perhaps that's going to decrease her motivation for barging in front of Tilly, so that when I finally get round to Tilly, she can have all of the love and fuss without having her confidence chipped away.
Brilliant. I think that's a great response to that. And that, I think that's we kind of talked about this before, you and I. I had a client who has two dogs who they're sibling dogs. They're about a year old. They're both boy Jack Russells, and because they're at home more, they've had the odd occasional scrap, but because they're at home so much with the coronavirus isolation, they're now really at each other. What would you suggest in that scenario?
Yeah, obviously this is now starting to become my topic of I'm hesitant to use the word expertise because I'm a little more humble than that. But obviously I've researched this for the past year. And so really what we notice in multi-dog households, but also siblings, is that owner attention can be a trigger for conflict. However, also moments of arousal, so that can be getting ready for a walk, confined spaces like the bottleneck we see often in hallways, feeding times. Going back to Rachel's, there's lots of case studies demonstrating that pain is often a trigger for conflicts as well. So really important to be managing those situations. So yeah, I'm not surprised that if there was a history of conflict, and now we have, potentially more of the cues for conflict present, because we are often associated with those cues through feeding, walks, attention, then I'm not surprised that conflict is increasing. Really, there are lots of factors to consider is managing behaviour. So identifying when do the conflicts happen the most. If it's around getting ready for walks, then, I think one of the issues I feel with siblings is that they kind of get, and not just siblings actually, but multi-dog households, is that often people lump them together and it all gets a little bit chaotic sometimes. And that's true historically for my own household.
Yeah.
So I think that if we notice that arousal levels are escalating, sometimes we just need to find a way of preventing that happening, perhaps through getting them ready for walks separately, feeding separately. You know, I see a lot of clients who feel that dogs in a multi-dog household, whether they're related or not, have to eat side by side, and it's like, no, they don't. They really don't. My dogs eat in 2 separate different rooms.
Yes.
And you know, then looking at owner attention, and I think I hopefully touched down on that a little bit with Rachel. Then really, you know, when it comes to siblings, part of the issue is that we have competition at quite a what's the right word? Thesis brain's kicking in again. Woohoo! Is that the competition can be very intense, and that's because they're the same breed. If they're the same gender, and there's a lot of studies that suggest that conflict is more likely with the same gender. Thankfully, with males, it tends to be less serious. So it tends to just be a hideous display of noise and kerfuffle. Whereas with females, there is a greater risk of injury. That doesn't mean to say that, there's not going to definitely be no injuries if males are involved, because every dog and every situation is different. But research suggests that actually female to female, or even female to male, there's a higher risk of injury. Because when women lose their temper, they don't half mean it.
We mean it, yeah, absolutely.
It's because they've got to defend their offspring. If you think about it, if they have a nest of offspring, then if that to get those offspring to survive, they have to be prepared to go really heavy. Whereas for men, males to pass on their genes, what they have to just do is out posture and be like, I'm really strong. It's really in the male's best interest to not get injured so that they can mate and pass on their genes. Whereas women are associated with the raising of the offspring and guaranteeing their survival. So they have to genuinely be a little bit more feisty. So don't mess with the ladies. Anyway,
absolutely.
So we've got same sex, probably similar size, similar behavior traits that come with being same breed or type. So there's going to be a lot of competition due to similar levels of motivation. And then also we've got hormones coming to play because they're both entire. So this is where I'd be looking at, is it sensible, if potentially there is an element of hormone influence, do we run a trial of perhaps Tardac, which is 2 weeks injection, maybe just try for one dog, or do you try for both dogs? And then if you see a positive change, then I would say that's a good reason to neuter.
So because we're talking about chemically castrating with the Tardac injection, aren't we?
I wouldn't go down surgical as a first port of call with any behaviour case, because we just don't know if it's going to make the problem worse. Recovering from surgery is potentially a trigger for various different emotional states, and so is pain. So I think it's just really important that we're very careful using surgery as a first port of call for behaviour modification. So I would probably look at Tardac because it's short-lived, and so then if it is the wrong thing, we've only got a short period of getting it wrong, rather than Superlorin, which is 6 months or 12 months. So I would certainly go perhaps down the short-term route of that. But really, for me to decide if chemical castration was needed, I'd be wanting to see some evidence of inter-male rivalry, i.e. it is partially influenced by hormones. And I would say at the age that they are at, that's probably quite likely. So entering sort of adolescence, you're going to start seeing some big sort of hormone changes, starting to become more sexually and behaviorally and socially mature. So then they're going to start thinking about, well, I want to pass my genes on, and this guy's here, so
cramping my style.
Cramping my style, and he's after my food, and he's going to go for a walk at the same time, and quite frankly, I just want him out. So this is part of the issue with siblings, and not just siblings, but they could be unrelated and similar age. But I would say looking at managing the context in which behaviour happens to reduce arousal, and that that's the difficult thing with any multi-dog household, but especially siblings, is that actually the management of starting to treat them like individuals rather than always doing everything together. And you know, it is a challenge, but a period of intensive management can have a massive amount of positive effect.
I think I always have so much respect for people who decide to take two dogs on at the same time, you know, especially two of the same age, because it's such a massive thing training a puppy as it is, let alone trying to train two at the same time, or even rescuing two together, and trying to work out their personalities and what they may feel maybe the resource they want most. And it's a huge thing to take on. And then, as you say, there's a lot of elements to it.
You know, it does sometimes work. But I think the most important thing is that dogs are treated like individuals. And even I generally tend to go for the 3-year age difference. I think it's a great age difference for a lot of dogs in a household. It's something that I tend to migrate towards as my little rule. But even then, I think it's really important we treat these dogs as individuals, that they get our individual walk time, our individual training time and play time, and that we don't just get caught in a cycle of doing everything together every day of the week. I mean, sometimes we have to, because life is busy and we've got stuff to do. But at least trying to get some individual time is quite important with all multi-dog households, definitely.
Brilliant. So what other questions have we got here? We've got one from Marley. My poor Monty is nearly 8 months. He was jumped on by a big dog a month ago. Since then, he's been in pain. We took him to the vet and they gave him meds and booked an x-ray, and then cancelled his x-rays due to COVID. Since then, he seems to have muscle wastage. The vets now say he has probably has a low hip score. I spoke to the vets again today, and they have changed his meds and won't x-ray yet due to COVID, but will eventually. Monty does appear a bit better over the last few days since I started to give him CBD oil. We have limited his exercise, but obviously he needs to build up his muscle. Vicious cycle, really, and sad to see him hurting. I think that's, you know, the thing we're hearing all the time. And I think in his case, what he really needs is to see a physio, which isn't really possible at the moment. So it's quite hard to advise on what the best thing to do here. Talking about the hip score, it probably actually has a high hip score because when we're looking at hip score, we want them to be lower. So just to clarify on that. But yeah, I mean, it's definitely important to try and get those x-rays done as soon as we can, and hopefully these restrictions will be lifted soon, and we can do that. Yeah, and there's not a huge amount I can do in terms of advising at the moment, other than just keep speaking to your vets, and they'll work with you and hopefully support you with that one.
Yeah. I mean, I would certainly say from behavioural or lifestyle management, while you're waiting for that crucial treatment, it's really important that obviously it depends on what type Monty is. For all we know, Monty's a massive Great Dane. But at the same time, I would say definitely picking him up, you know, looking at stairs, picking him up to, you know, get on and off things like perhaps even the sofa, or getting in and out of the car. And making sure, you know, there's perhaps some runner rugs for around the house, so that you're just trying to reduce any extra effort that he might be making in his everyday existence. And then you may find if there is muscle wastage, and, you know, do pardon me if this is beyond my remit as a behaviourist, but I would certainly be looking at making sure that there is perhaps a extra intake of higher protein food, like fourth grade wet food or something like that, because obviously protein helps build muscle mass. So if we have got a bit of muscle damage, then, you know, increasing protein intake may potentially help. Obviously, if that muscle is just incredibly damaged, that might not have any impact. It depends on where the muscle wastage is taking place. If it's overall across the whole body, then it might potentially be linked to metabolism change that you see in development. So sometimes as dogs enter adolescence, their metabolism changes in response to their hormones, and so they actually get leaner because of the effects of their body going through those changes. So it depends where that muscle wastage is. If it's obviously you know, in a certain area where the issue happens, then that's fair enough. But if it's generally kind of all over, he looks a bit
be a shape.
Yeah, and you know, I would certainly be making sure that Monty isn't doing too intense exercise, because obviously and just being careful about which dogs he's meeting on his walks, because if he is in pain, we don't want him then to develop a behaviour problem because he's meeting dogs when he's feeling vulnerable. So trying to look ahead at dogs that are around and go, oh, do you know what, that Labrador's just met that dog and he went up really slowly and he seemed really relaxed, so that's a nice dog for Monty to go hang out with. That's what I'd be doing. So it's not keeping him away from dogs altogether, it's trying to make sure that he's interacting with the dogs who aren't going to startle him and scare him, the really polite, slow-paced, hello, how do you do, dogs. They're the ones to try and find.
Gentle, friendly.
Yeah, so he retains that social confidence that we don't want him to lose. Yeah, tricky one that.
It is, yeah. I think from what Marley's just saying, he's a golden retriever and it is around his hip. So yeah, I think it's again just being sensible, and hopefully we'll be out of these restrictions soon. And as soon as we can, get him to see a physio, and you'll see hopefully some good improvement with that, with some advice there. Last question, I think. So Alice Kingston, let me pop that up on the screen. I have a 7-year-old Staffy Cross. She's permanently on Metacam and for an odd lump on her leg. Her other leg has cruciate issues. She seems to have issues with confined spaces and has a bit of a split personality. Is this all pain related? Well, that's a really tricky question to answer, isn't it? From a pain practitioner point of view, I would always want to do a full pain assessment and probably a pain relief trial. But what would you say from a behaviourist point of view?
I think just recalling the last bit of the description used, she sort of seems like she has a split personality.
Yeah.
That information for me, if I was to be having a face-to-face conversation with Alice, or Alice is welcome to answer, my response is, well, what does that look like? Because I could start to imagine behaviours that are totally different to what Alice is seeing. And I think it's really important when we are describing behaviour that we go careful not to apply a label without actually giving descriptions of those behaviours. Because if I was to say my dog looks happy, then 5 people watching this might imagine a totally different behaviour to what I'm perceiving as happy. Whereas if I was to say my dog, when they're happy, their ears are in neutral, their face is really relaxed, they hold their mouth a little bit open, their tongue is inside their mouth, and their eyes seem really bright, and they do a side sweeping wag. Now we've got some behavioural indicators that actually this dog is in a positive emotional state. So when it comes to split personality, I'm thinking in response to that, well, what does that look like? When does it look like it? And what do we think we think the dog wants out of those, what's the motivator behind it? So it's really tough for me to say. I think anytime behavior is difficult to interpret or predict, so sometimes we're like, I don't know where that came from, I cannot find a cue. In other words, I can't find the conditions. It's so random. No matter how hard I look and how careful I look at it, I'm pretty much always going to be referring that dog back to the vet. Because any time a behaviour doesn't make sense to me and I'm just like, this is really weird, I'm usually sending them back to the vet and saying, just being like, I would like to rule out that isn't caused by something, very, in my opinion, all of the very, very unusual behaviours are probably something that we just can't see or measure. And it's a really tough job for vets to measure it, because vets can't just throw every test at every dog on the assumption that they'll one day find it, because it's expensive and people don't want to, it's not fair on the dog to have every test under the sun. So it's a really difficult situation. But it is important. Anytime we can't make sense of a behaviour, we can't predict it, we can't see the reinforcer, or then usually it's that there's something inside that the dog is feeling that we can't perceive.
Yeah, she's just added to this. So she said that she loves humans. She hates dogs getting in her face, which I think is very common. She generally is happy, but tends to go into a grumpy, growly mood at home. Tends to be an hour every evening. I've tried many things, can't manage her with treats as she resource guards, and vet has no ideas. I think if this was a case that I was dealing with in practice, that I would definitely want to do a full sort of a behavioural chat. So from my perspective, it would be, let's list all the behaviours and all the changes, and let's see if we can put them into any groups of what pain could be there. And then I would probably start with managing those pains and seeing how we go. Obviously, you've got some element of learned behaviour. So from my perspective, if this was my case, I would probably start on a pain management protocol, see how we go. Once I was happy that I felt we'd managed the pain, that's when I'd get somebody magical like Roz involved to then help with trying to unlearn some of the things, because there's a lot of preemptive behaviour there as well, I'm sure, but very difficult without a proper consult. And it may be that you need to go and get her referred to some kind of pain practitioner or similar.
Yeah, I think what I will say to that is pretty much, I'd say a very, I was going to throw a random percentage on there, but there's no data underpinning it. But when I see cases that are more growly in the evening or more antagonistic in the evening, ruling out arousal caused by boredom or frustration, pretty much a lot of the time we're looking at that actually, because the day has had been full of walks, activities, movement, people coming and going, by the time it gets to the evening, that there is sometimes soreness involved. So for me personally, whenever I hear that description of in the evening we get this period of growly behavior, it's either to me that a dog is exhausted, and I'm not suggesting it's this dog, but sometimes with dogs that just do not get to rest because the household's too busy or they go to work with their owners, it can be that those dogs are just absolutely exhausted and just want to be left alone. Or it can be that if this dog, is like, yeah, I love my walk, even though I hurt, I still want to move and explore. But and then people are home. Yay, I'm excited. People are home. But all of those activities stack and cause a build-up of soreness. And then in the evening, she's just like, oh, just leave me alone. Don't touch me because I hurt.
It hurts.
Yeah. So that
and
was
we know
my line of thought with that.
Yeah, and we know in people that pain is worse at night. So I think that's very often the case in dogs as well, and particularly in the evening when things are quietening down, there's no distractions going on, your brain is very much focused on that thing that's affecting you. So I think it's definitely worth maybe investigating a few more things. And I always say this with pain management, as long as you're sensible with what drugs you try, the worst case scenario is it's not going to help. So I would normally, I would suggest that would be a good first port of call really for this dog. A tricky one, isn't it?
I mean, you could expect. Yeah, but my understanding is, having had an old dog who tried lots of different medication, is, pain relief isn't a one size fits all for all dogs, and pain is incredibly complex. I did I had a couple of lectures on it for my clinical animal behaviour degree, and I was just like, that's really hard to get my head around. Pain is actually there's still so much they don't even know about pain. So actually it's really important we don't get stuck on one medication for our dogs that we know experience pain. And I've been here with my own dog, that we aren't afraid to, under the guidance of our veterinarian, try sometimes even a different dose if there's room for upping the dose, but also looking at changing the medication. I think it's too easy for us to get stuck on what we, that will do. But actually sometimes it may be that your vet can take you through different medications that are available as well.
Pain, more meds, and then weaning off them. There's so many options. So
it's so complicated. Absolutely. And you just find a vet who's, if it's not your existing one, you find one who's ready to go on that journey, because it can be a real journey. Having been through it with my own dog, I know all too well that is trial and error.
And you have to work as a team, definitely, and it's hard. There's no one fits all for everybody, unfortunately. So you think you're absolutely right there. That's brilliant. I thoroughly enjoyed this, Roz. You probably know what we do on Cam, but we like to do this thing called 10 top tips, where we list 10 advice things that we would be useful for dogs in general, and particularly arthritic dogs. I thought we could make this slightly arthritis, slightly corona based. If you fancy it, I'll start with number 10.
Hannah did this to me last time. She just sprung it on me, and I was just like, I had a proper brain fart where I was just like, I don't even know who I am anymore, but I'll do my best. Okay.
We can always make it 5.
I'll just recite the last 10 that I did, and then half an hour later I'll go, why didn't I do this, and that? So I'm going to do a little mixture, because actually, it is quite a unique scenario going on. I think my can I say top tips number 10 to 5 and cluster them, but definitely getting your dogs used to being alone. at this time. I know that I've seen in my own dogs some behaviour changes where they've got used to me being around a little bit more. And if you're not sure how to do that, then reach out to a trainer. A lot of us are doing Zoom consults, and there are some sessions that are perfectly adequately done via Zoom, and separation anxiety training is certainly one of them. So getting your dogs used to being alone, again. Certainly enrichment, so looking at lots of chewing, sniffing, especially with the decreases in exercise, and with socialization for puppies is another I'm going to cluster my tips because I'm only at 3, but this is so much information. So with puppies, some puppies aren't getting their vaccinations at the moment, or they're halfway through their course. We're recommending that some puppies are carried. If you are carrying them, have an emergency little slither of some sort of soft treat, so that if they start to wriggle and you can't put them on the ground, you can start to get them to nibble on a treat until you can get them home. I'm suggesting that if you have a family member, that you drive that puppy to the supermarket, and while one of you goes in, the other parks has the boot open with the puppy, and the puppy can just watch the supermarket car park activity from a quiet point of the car park. Front garden socialization, playing noises, perhaps owners wearing hats, but put them on in front of the puppy so they know you're not just appearing from behind a door like wearing a beard and glasses. So making sure we're not traumatizing our puppies in the name of socialization. So I think keeping it on point to COVID, I feel like if I go down the arthritis route, I feel like because I wasn't on here that long ago, I feel like I'm just reciting the same old stuff, but my top tip is always runner rugs. I've kept the rug industry in business with my with Dental, who I sadly lost in January. Car transport is so important. Making sure it's comfortable for dogs during transport is absolutely crucial. Observing their response to activity. So for instance, like looking for hesitation, even when it comes to things like treat searches, looking for hesitation or how much more difficult things are. So when Denzel did his snuffle mat, I would put it on a chair so he didn't have to reach all the way down to the ground for it. And he just stood up and did a snuffle mat at this height. And then with socialization, when our older dogs or arthritic dogs are interacting with other dogs, is stay close to them. Nothing seems to break my heart more than seeing an old arthritic dog, or not even old, a arthritic dog, because they can be any age.
Yes, absolutely.
Just being like, trying to keep up with their owner and not even having time to sniff. And their owner just, not slowing down and providing that moral support. And that dog's whole walk is spent trying to keep up. And that really grinds my gears. I think it's
enjoy your time with your dog. That's the whole point in going for a walk, is to spend your time with the dogs. Walk in line with them or happen in front of you. That's my rule of thumb.
Learning to slow down. And as someone who said goodbye to their dog not too long ago, or one of my dogs, I'd say just those final walks will be the things that you remember the most. So actually slowing down and really connecting with your dog and putting your phone away, and actually, apart from if you're taking photos of your dog, that's fine, you can take a million photos, but then put it away and connect with your dog. So they're my tips. I think that was probably about it.
Amazing.
They were broad. That's perfect.
My things to add to that is obviously has so many resources. So if you have got any questions, you've got any queries about your pets, then please contact us. Use the Holly's Army, use the reviews site for all of our different equipment, and obviously the main Canine Arthritis Management page. We try and tackle so many things. And if you want to find out more, then do look up Roz. She's the Mutti Professor. As she found from this live, she knows her stuff. So
thank you.
Look her up.
Hopefully I didn't get thesis brain too badly.
Oh no, perfect. You're brilliant.
Give it. So, next time it'll be worse.
Well, thank you so much for your time, and thank you to everyone for watching and sticking with us with a little bit of technical defaults.
Sorry.
No, I think it was just unfortunate with everybody streaming at the same time with
I've
corona.
noticed it at this end as well. So yeah, thanks for watching, everybody, and look after yourselves and stay safe, and as best as we can. Everyone's situation is different, but of all these things, I'm trying to enjoy slowing down and having more time, and putting that time to the very best use that I can. And I hope that no matter how challenging your situations may be, that you may be able to do some of the same. And most importantly, stay safe.
Absolutely. All right. Take care, everybody. Good night.
Thanks very much. Bye.